February is Gallbladder Cancer Awareness Month. And this morning we have Dr. Kumar here to tell us a few of the symptoms to look out for, some of the factors of people who might be getting gallbladder cancer. Good morning, Dr. Kumar. Thanks for being here.
Good morning. Yes, nice to be here. Yeah, gallbladder cancer is not very common. Only about 20,000 Americans are affected every year, and so it's a good thing to be aware of. Otherwise, you would not think to be aware of it, unless we had a month to remind us to be aware of such a rare cancer.
Right, exactly. And you were telling me some of these statistics. There are a lot of people who are at risk for it, but just because you're at risk doesn't mean you're going to get it.
Yeah, what I was saying is that one of the risk factors for gallbladder cancer is gallstones. You know, 4 out of 5 people that develop gallbladder cancer are found to have gallstones at the time that they take the gallbladder out. But what we ought to reassure people is that gallstones are extremely common in the population. You know, 10 to 15% of people, if you just did an ultrasound on their gallbladder, are going to be found to have gallstones, and the vast majority of them are not symptomatic and don't need their gallbladders out, and less than 0.1% of those people are at risk of gallbladder cancer. Just the fact that you have gallstones does not necessitate taking your gallbladder out, right? While gallstones, in fact, are one of the risk factors for gallbladder cancer.
Right, so it's just something to be important and aware of. And so if you're thinking, okay, I have gallstones, what are some other symptoms that you need to look toward?
That's a good point, because gallstones and infection are oftentimes, you know, gallbladder cancer can mimic those same symptoms. These symptoms are abdominal discomfort, particularly in the right upper quadrant, you know, turning jaundice. Jaundice is when you get yellow skin. That's because the bile duct is blocked and you can't get rid of the bile into your small intestine. You can get bloating, abdominal pain. Weight loss is a very distinguishing sign between gallstones and gallbladder cancer. Usually gallstones cause symptoms of abdominal pain, can make you yellow, sometimes associated with fever, but they shouldn't cause weight loss. And you know, gallbladder cancer, there's the bile ducts, the ducts that carry the bile from the liver, and that's what the gallbladder does. It stores your bile before it squeezes it into your intestine, so you can break down fats and get rid of cholesterol and digest your food. And so all of these things overlap and mimic each other, and so this cancer occurs, you know, either as a risk factor of gallstones or gallbladder polyps. On an ultrasound, sometimes you're noted to have a polyp, and most polyps don't even turn into gallbladder cancer, and that's why we follow them, and only when they get larger, like 1 centimeter or larger, do we consider that might be a risk and take the gallbladder out. So it's a rare cancer. There are some common risk factors, but these risk factors don't mean you're going to get cancer. It's not something you need to worry about. But it's out there in the community. If you didn't know to seek these signs or know these signs, you might ignore these. It is certainly something you can be evaluated for.
Definitely good to be aware of those, and of course have the discussion with your doctor.
That's right.
All right, sounds good. And if you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. And of course, don't forget to like Dr. Kumar on Facebook and visit his website, drkumar.com.